Hi everyone, my name is Stefan, I'm a pulmonologist. In this video I'd like to review and demonstrate how to use the Fostair NextHaler device. I'm not endorsing Fostair, so there will be other videos on this channel on different inhalers. I just try to basically demonstrate how to use them, show you what I like, what I don't like about them, so maybe you can make an informed decision together with your doctor. As I said, these inhalers, they come in different shapes and sizes, different devices. Some are easier to use, some are more difficult to use. So you can see there's a bunch of devices that I can show you. So I'll try to cover many of these in the coming videos. But for this one, we will focus on Fostair. So Fostair is also called Fostair in some places around the world. It's an inhaler that's very commonly used. This is called NextHaler. There is another Fostair inhaler, which is this one. So this is another pinkish looking inhaler, but it's different. So this is a dry powder inhaler. This is a metered dose inhaler. So DPI versus MDI. However, this is used slightly differently compared to this one. So basically, I would like to just point out that this inhaler is a combination of medications. So it has two medications inside. One of them is a steroid, a corticosteroid, so an anti-inflammatory drug. The other one is a long-acting bronchodilator. So this is a medication that opens up the airways and keeps them open for about 12 hours. So that means that you would have to use this inhaler twice a day, theoretically. So your doctor may recommend it slightly differently, but basically, ideally, this should be used twice a day. And normally, you just take 1 or 2 doses each time. To use the device, it's very important to note that it just has a lid up here that basically to activate it, it's very simple. You just flip this lid open, and then the inhaler is really ready to go. So there's nothing else you need to do. There's no extra step. It just has a air intake here, which you need to be mindful of, because if you cover it while you're inhaling, it might not be as effective. So basically you need to hold it pretty much like this. You don't need to shake it or anything. Here you have a dose counter. So this is something that's useful as well, because it tells you how many doses are left in the device. Now it's showing 115. Now, this is the mouthpiece. This is where you'll be inhaling from. So I'm just going to next demonstrate how to use this inhaler. But first of all, I'd like to just remind you that because it's a dry powder inhaler, so it has a powder inside, you need to inhale forcefully and deeply. So you first empty your lungs completely with the air all taken out of your lungs. That's when you breathe in deeply and forcefully, and then hold your breath for 10 seconds if you can, and then slowly release. So I'm going to do that now so you see how this actually works. So breathing out first. And slowly release. So I haven't held my breath for about 10 seconds, but please try to hold your breath longer. For the sake of the video, I won't keep that longer. Once I've done that, basically I just close the lid. You hear it there's some clicking going on, and then it's closed. And if I look at the dose counter, I'm not sure if you can see it, but it shows 114. It was 115 before. Now I'm just going to take another demonstration dose. Don't worry, this doesn't have any medication inside, so it won't harm me. But I'm just going to show you again so you can understand this better. So I open the lid to arm the device. You hear the click, so then you know it's ready to go. Breath out, and then we'll do it. And slowly release. So try to hold your breath longer if you can, as long as you can. About 10 seconds should be fine if you can. And then I close the lid because I'm done. It goes on its clicking motion. And that's it. So now the inhaler shows 113. Now, one thing that is interesting about the Fostair NextHaler, and I actually quite like this, is that you don't lose doses if you don't inhale properly. So for example, say I opened the lid and I changed my mind. I didn't want to take the dose anymore. So if I close it at this stage, it's still showing 113. So I haven't lost the dose. I'm going to open it up again and I'm going to take a dose, and you will see that basically there is a sort of a click that happens when you breathe in hard enough. So let me do it again. Have you heard that there was a click that happened as I was breathing in? So when you breathe in forcefully enough, this inhaler will trigger. If you don't do it hard enough, it won't. So this is why it's important to really empty your lungs before you attempt to take the medication. I'm going to close it. 112. So I've taken a dose. Something to be mindful of, and this is for all dry powder inhalers, is that you must really take it correctly. So you really must empty your lungs before and breathe in forcefully. Otherwise, you won't take the medication properly. It's supposed to reach the deeper parts of your lungs. So this is something you really need to be mindful of. So breathing in deeply and forcefully with these dry powder inhalers, like Fostair NextHaler, will help deliver the medication where it's needed, in the smaller airways of your lung. If you just take a shallow breath, it will end up in the back of your throat where it doesn't really have any effect to control, for example, your asthma. So please try not to do any inhalation that looks like this. Now it's triggered. You heard the click, but that was a very shallow breath. So please don't do that. You really need to take a forceful, deep breath. Hold it, and then release. Right. So I'm gonna close this now, and just to remind you before we end this video is that because this inhaler, like Fostair, it contains a corticosteroid, it's very, very important to try to rinse, gargle, and spit with some water after you've taken the inhaler. So have a glass of water handy when you're taking the dose. Take some water in your mouth, swish it around, gargle, spit, and that will remove any sort of medication that may have been left at the back of your throat, which may sometimes cause oral thrush or a hoarse voice. So that being said, this is the Fostair NextHaler. In future videos, I will review some other inhalers that are commonly used, that are commonly prescribed to patients. So hopefully this is helpful to you to help you decide which one you might like best. All the best and take care.